Relief. Urologist and Dr. Jason Burrus joins us right now. He's from the Urology Center of Alabama in the Alabaster area, talking about a specific issue, but how it can be treated. And the issue is called benign prostate hyperplasia. Is that correct?
That's right. And you'll hear people call it BPH for short, because we don't like having to say that every time.
And what does that mean exactly?
Well, so all men who haven't had their prostate taken out have a prostate. It's a small gland that sits at the base of the bladder. It's involved in men's sexual function. But as we age, it gets bigger, and as it gets bigger, it kind of starts to pinch off the tube that men urinate through, and so it can cause a lot of symptoms. And
you were talking earlier, you were saying this is fairly common. And in what age group is it most common?
Very common. So millions of guys every year who have BPH. Some of those men never show up to get treated. Age range, probably the 40s, we start to see men start to present with it. But as we get older, 50s, 60s, 70s, we really see it start to become more common.
And there's a long list of symptoms. What are kind of the biggest symptoms that you see that are connected to this issue?
So most commonly we see things like a weak urinary stream, difficulty emptying the bladder, up a lot at night to go to the bathroom, urgency and frequency to urinate, difficulty getting started, and in real severe cases it can cause a lot of kidney and bladder problems.
And we were talking earlier too, you told me about 40% of men don't even get treatment for this. I can't imagine. I mean, you just mentioned a long list of issues that are pretty uncomfortable, I'd imagine.
Yeah, a lot of wives elbowing their husbands at night. But it is a lot of people who don't get treated. Of the people who come in for treatment, the vast majority of them end up on some type of medication. And the medications these days do work very well for a lot of men. But for some men, they don't like the side effects. They can't tolerate the medication, or maybe it's not working as well as it should, and so they end up going on to surgery. And surgery typically involves the removal of some part of the prostate, and that can lead to its own problems. The exciting part of what we're seeing now is we have some options we can offer men in the office or in the operating room, which are a little less invasive. One procedure in the office called Resume, which is a steam-based injection. Shrinks the prostate over time. And then one of our newest add-ons would be Urolift, which is a procedure where we look into the man's bladder and put an implant in to just push that prostate tissue out of the way. And because there's no destruction of tissue or energy used, it doesn't affect sexual function, and men get back to activity very quickly and see very quick results. You
were just saying, Dr. Burrus, there's probably a lot of women who are bumping their husbands at night, but there might be some women bumping their husbands watching right now, like, this is you need to go get this checked out. So if people are at home watching this, husbands, wives, they have more questions about treatment, about this issue, how can they contact you all?
Well, just check us out, urologycentersalabama.com, and you can find our phone numbers. All our contact information is there. We've got videos and pages on all this stuff.
All right. Well, thank you so much, Dr. Burrus.